Hello again. Today we are going to talk about dental implants and diabetic patients. So, can diabetic patients have dental implants? The answer of this question is yes. Diabetes patients can have their dental implants and it will last lifelong. Dental implant survival in diabetic patients is as good as healthy individuals according to my own practice and also to scientific studies. But there are a few key points that I would like to share with you. First of all, I will talk about the main points of the diabetic patients should have in order to have implant surgery. Secondly, about the titanium properties that should be preferred in diabetic patients. And finally, the prosthetic teeth properties that should be fabricated on it for making the implants long lasting. First of all, as it is known, since the glucose in the body cannot be taken in the cells in diabetic patients, the cells cannot use this glucose as a nutrition and there may be various disruptions in bone and soft tissue healing. So if you are watching me as a diabetic patient, you understand very well what I'm saying. So your fasting glucose levels should be maximum around 200 milligrams per deciliter and your hemoglobin A1C test, this is another test which measures average of 3 months of blood sugar, should be below 7.5%. Secondly, I use active titanium in diabetic patients to further increase the already high chance of success. These active titanium implants are not available in all brands and come in a special airtight box. It is not offered to many patients because it requires high experience and practical speed to be placed in the job. Since active titanium implants are produced with the latest technology and their connection to the bone is 2 times more than the normal implant, I prefer this implant in diabetic patients in my routine practice. And I know that it is the correct titanium type that should be used also according to the scientific literatures too. Finally, I will talk about the zirconia prosthesis design that should be fabricated on these implants. In non-diabetic patients, the prosthodontists they attach the zirconia to implants with very powerful cement that it never goes off. However, in diabetic patients, I don't recommend this design. I prefer mostly screw fixed design. With screw fixed design so that they can be taken off by any dentist and cleaned time to time for not damaging the bone underlying it, because food around the implants make bone resorption, and in diabetic patients this can be a risk factor for losing the dental implant. Thank you for listening.